You hear a lot about weight loss injections these days. It's related to women's health, right? I'm Dr. Siva. Today we are exploring injections, weight loss injections like Mounjaro, and how it relates to your fertility, menstrual cycles, contraception, and pregnancy planning. There are four different, probably interlinked situations I see in the clinic. So let's go through them together. First situation is I want to use Mounjaro to lose weight and I'm going to try to conceive. So that's why I want to lose weight. This is a typical, say, for example, a classic 30s plus age patient, and it becomes a very nuanced conversation, balancing the medication as well as trying for a baby. So the Mounjaro isn't licensed for use during consumption attempts or during pregnancy. But can it help before trying? Potentially, yes. That's because increased weight like PCOS affects the ovulation. Insulin resistance affects ovulation. Mounjaro helps with reducing the weight, improving the insulin sensitivity. So what we could do is we could use the Mounjaro as a part of pre-consumption optimization of that metabolic health to reduce the insulin resistance, to regulate the cycles, reach a healthier weight. But it is very essential to stop it before trying for a pregnancy. The guidance currently is 2 to 3 month washout period before trying for conception. Say, for example, you try in November, you want to try for pregnancy from November, then you stop it in July or August. So, say if you're nearing 40, you're also thinking about ovarian reserve like AMH, antral follicular count, and the whole fertility picture. So, these weight loss injections should not delay your fertility assessment. You can go through those investigations while you're on Mounjaro. However, you need to have a clear exit plan from the Mounjaro injections, a preconception plan. So, discuss it with your doctor and the fertility specialist. When we on Mounjaro or the weight loss injections, stop it at least 2 to 3 months to give a washout period before you try for your pregnancy. The second situation I see is my cycles are anyway irregular. I'm not going to become pregnant. Why do I need contraception? The short answer is if you're going to be on any of the weight loss injections, it's better to be on a contraception. Irregular cycles doesn't mean you can't become pregnant. You can have ovulation here and there. If you're on Mounjaro, you quietly restore the ovulation during that weight loss period. Even before your periods become regular, the ovulation can happen. This is especially true in many of the PCOS obese women who are on Mounjaro. They lose the weight and suddenly ovulate. Without realizing it, they could conceive. These surprise pregnancies are now called as GLP-1 babies in the medical world. So, if you're on Mounjaro or any of the weight loss injections and your cycles are irregular, never assume you can't become pregnant. Ovulation is possible and it is better to use a reliable contraception. The third situation is women who come for a pill check, they will be on contraceptive pill, they will come for a regular pill check and they would say, oh, I have been started on Mounjaro on a different clinic and I'm on them. This catches many of us off guard. The main reason is they may not have known that the Mounjaro affects the contraceptive pill because Mounjaro slows the gastric emptying. It's good for the blood sugar and the appetite control, but it's not good for the medications that rely on gut absorption because it delays the gastric emptying. So there's a 20% reduction of the contraceptive pills. 20% is not a small amount when we are talking contraception because that would end up in contraceptive failure, isn't it? But this is not a GLP-1 class effect. The Ozempic, Wegovy, Saxenda, they don't actually do this. It's just the Mounjaro. So the regulators, MHRA in the UK, TGA in Australia, FDA in US, all of them say the same thing. When you start a Mounjaro or increase the dosage, you need to be on additional non-oral contraceptive or add the condom use for 4 weeks. So there's an arbitrary timeline for 4 weeks. That's because the gastric emptying is slowed the most in the first 4 weeks after change in the dose. Say you're going from 2.5 to 5 or 5 to 7.5 of the Mounjaro, then your pill will be simply less reliable during that period. When I say pill, it is a combined contraceptive pill and the progesterone only pill, both. So it's better to be on contraception like Mirena or Kyleena coil, copper coil, implant like Nexplanon that you have it in the arm. or your partner could use the condoms while you're staying on the pill for that extra 4 weeks. If your prescriber for the Mounjaro has not brought this up, you need to bring it up in the conversation because contraception is an important topic when you're going to be on Mounjaro injections. Fourth situation is I'm on Mounjaro and I found out I am pregnant. This is where the panic button hits. So let me give you the calm thing first. Don't panic. Accidental early pregnancy exposure looks low risk at the present moment with the data we have. So there was a study in 2024 which followed the first trimester GLP-1 exposure, and they didn't find any increase in the major birth defects compared to the women who weren't on the same GLP-1s, because diabetes and obesity itself actually is a high risk for fetal abnormalities. So they compared the women who were on injections who were not on injection in both the diabetic and the obese women, and they didn't find any birth defects extra on these. However, this is not licensed to be used in pregnancy. So every regulator in the world, MHRA, TGA, FDA, all of these say the same thing. Stop the Mounjaro or the weight loss injections as soon as you know you are pregnant. Our goal is not weight loss during the pregnancy. The baby has to grow, isn't it? So if this is you on a weight loss injection and you found out you are pregnant, stop the injection. But you don't have to panic. You need to let your GP, family physician, OB-GYN know that you were exposed to the weight loss injections in the early pregnancy. You don't have to spiral with fear. Just the early accidental exposure is not a reason to panic or terminate a pregnancy. So these are the 4 common situations I have seen in the clinic. Probably other doctors would have seen other situations as well. So bringing it all together, I just wanted to summarize this thing. Mounjaro is a very powerful, all the weight loss injections are quite powerful. They transform the metabolic health, that's no doubt. But it sits right in the intersection between the weight reduction programs, hormonal health, fertility, pregnancy planning, or contraception. That intersection is not being talked about much. So these conversations should ideally happen at the time of prescribing the weight loss injections. And if your prescriber has not discussed it, better discuss it with them. And if you have any further questions about this topic, feel free to comment on the link in the Instagram as well as the YouTube. I can answer as much as I'm aware of, or I can find out the answers for you. Take care. Stay tuned.